Hello, my name is Biz Steinberg. I serve as the CEO for the Community Action Partnership of San Luis Obispo County, or as we call ourselves, CAPSLO. CAPSLO celebrated its 55th anniversary this past year. What a year to celebrate. CAPSLO has shown its resilience over the past 55 years and continues to grow. When COVID-19 closed many businesses last March, CAPSLO carried on, never closing the doors of most of our programs. An agency COVID task force team was immediately created to work on policies and procedures during the pandemic, meeting weekly for the first few months. And as we went through the pandemic, these policies and procedures had to be updated based on the CDC and the State Department of Public Health. We were able to keep our staff that could not work due to COVID restrictions working in other CAPSLO programs. For example, our energy installers went to work in the agency's facilities department, helping to install protective equipment at CAPSLO program sites. Training and meetings turned to, guess what, Zoom, which meant investing in iPads, laptops, and other technology for staff to work remotely and keep in touch with families and children. This is where the balance of distance learning as well as in-person services in the centers operated as needed, because we might have someone ill and we'd have to close the classroom. So it was a real balancing act for our early care and education staff. Staff created learning videos to share with families in the Head Start and Child Care programs. Those were posted on our CAPSLO YouTube channel for easy access, and they are still there today. Our local Trader Joe's and school districts donated food that family advocates made sure families in need received. In a 7-day period, 866 families were provided food in our San Luis Obispo County. Our family child care providers continued seeing children in their homes so parents could continue their essential work. On many Saturdays, and this continues to this day, the CAPSLO Child Care Resource Connection offers drive-by supplies such as PPE, diapers, wipes, information, etc. So it's been a real connector, and we do this in North, Central, and South counties. The Adult Day program created entertaining videos for our guests with dementia and would leave care packages at the doorsteps of the families. They are back in the returning to the center with some friends attending in the morning and others in the afternoon, giving families the respite time that they need. CAPSLO's health clinics offered treatment medications, birth control, emergency contraception, and testing in a drive-in car hop manner and continue that today. Some of our staff even were wearing roller skates to make it fun. Recently, we held the CAPSLO Migrant and Seasonal Head Start pre-service as the season is beginning this month. Staff were returning to work and were able to reach almost 400 staff in 1 week of pre-service. In normal years, we would travel to each county to train the staff. We are learning how much time is saved by these virtual trainings and will continue with them as we move forward. So even though we've had the pandemic, we, as well as many of you, are learning what approaches are still going to be and are effective post-pandemic. The attendance at our board meetings is also up. Although the board members talk about how much they miss the in-person time or sharing a meal together, they are remaining very active and engaged. One of their first actions in April was to approve a number of policies and procedures pertaining to the pandemic. And I want you to know that we had so many that this is an additional binder that accompanies our human resources personnel manual. We've installed electronic temperature monitors at many of the CAPSLO offices. We've updated COVID information on our employee intranet. This is the most valuable spot where employees can find out anything they need to know. They have access to the most current guidance from the CDC, as well as all of our updated agency policy and procedures. We are starting to look at what it will be like when we start having staff come back into the office. We're looking at hoteling stations, making sure staff are 6 feet apart, and of course, we all continue to wear these face coverings, but this is still a few months away. A lot of planning is going to go into this, a lot of work with our staff. I mean, we haven't ever closed, but we have sure modified. So we will be continuing to modify, offering the quality programs that are expected of our organization. CAPSLO has continued its essential work in the communities we serve in 11 counties. I'm so proud of the staff here at CAPSLO and how they immediately adjusted to the new way of delivering services. They are still and continue to help people and change lives every day of the week. Thank you.